the Taiwanese government is starting its 3+4 day quarantine rule for incoming travelers. Do you think this is the right time to implement this rule? Is it too late or is it too early for this rule?
I think for a traveler who's doubly vaccinated, doubly boosted, has a negative PCR test pre-board, and undergo a 3-day quarantine followed by 4 days of self-monitoring with one or more negative rapid antigen tests. I don't think that the rule needs to be more or less strict. I think that the risk of that person really introducing an infection to Taiwan is going to be very low. And that's why I think this rule is actually very much a science-based decision. It's consistent with Taiwan's new policy, the new Taiwan model for living with COVID, and certainly help promote those social and economic activities as well as international exchange while being able to keep the Taiwanese people safe.
Long COVID has been a serious concern for a lot of people that are recovering from COVID. So, how serious is long COVID?
Most people with COVID have symptoms that last no more than 2 weeks. But when you have symptoms that persist for more than 2 months or more, that becomes long COVID or what we call post-COVID syndrome. Certainly some of the most common symptoms include fatigue, shortness of breath, and then some type of cognitive impairment, what some of us can describe as this brain fog. You just cannot think or remember things as well. But the long COVID could actually affect multiple organs and systems.
Taiwan just discovered the new Omicron variants, BA4 and BA5. Do you think we should be worried about the new variants?
In the United States, that BA4, BA5 are accounting for about 21% of the new cases. And I heard that just yesterday, Taiwan detected 26 new cases of BA4, BA5 through border control. So that's certainly something that we have to stay very vigilant about. Based on very limited data, we don't think that BA4, BA5 are going to cause more severe diseases compared to BA1 and BA2. But based on the way it's spreading so fast in Europe and in the US, we do think that it's going to be very contagious. And anytime you have a contagious infection, there's always higher chances for increased hospitalization, ICU, as well as deaths.